Hi, I welcome you all to this discussion on replicated case note from the OET exam held on 26th April 2025. So let's start. You can see the case note on screen. This is the first page, which contains the patient details, then the social background, then you can see the medical history, medications, then GP's appointment details, then the recommendations plan and the writing task. So as we all know, when you get the question paper for your writing test, initially you have 5 minutes just to read through the writing task and the case note and understand the scenario, during which you'll not be allowed to use your pen or pencil. So during this reading time, how do you manage this reading time? Where do we usually start our reading from? First, you read the writing task. Before reading the writing task, the first thing would be you can understand what your role is. From the first page, from the very first line, you understand what your role is. You'll not be allowed to do any markings, but I'm just making a mark here for you to understand. This is the place which shows what your role is. You understand your role, that you are a community nurse at community health nurse at Old Town, taking care of elderly patients. Okay, you understand that, and then you immediately skip on to the last part to understand the writing task. So from the writing task, we understand who the reader is. Using the information in the case note, write a letter to the patient's new community health team. So now the patient, so from this we have to understand that the patient is now being handed over to another community health team, and we are supposed to write a letter to that community health team. In your letter, briefly outline background, medical history and required care. So the social background, the medical history and the needed care for the patient are to be included in the letter. And address the letter to Mr. Mark Graham, Community Health Manager. You have to write to the Community Health Manager. So the scenario is clear. You are a community health nurse taking care of elderly patients, and from your care the patient is being now shifted to another community health team, and you are asked to write letter to the community health manager of that team. And in the letter you have to include all the necessary background, social background and medical history details and the needed care for the patient. This is the scenario. Now let's look at the plan as well. In the plan there aren't further details are not given, just write a letter to community health manager. That is the only information given here. Plus we have some points in the recommendations, that is post move to the new home. Okay, from which we understand that from the writing task itself we understand that, like now the patient would probably be shifted to another community, and so after moving to the new home in that community, what are the requirements? Dietitian for daily dietary requirements, and occupational therapist for making arrangements and setting hospital bed at home. So during the 5 minutes, again let me tell you, you'll not be using your pencil, you'll be just reading through the case note and just understanding things, that's it. Now based on the requirement, based on who the reader is, so here our reader is the community health manager, and the requirements, partially it is clear to us from the recommendations, that is a dietitian's requirement is needed and an occupational therapist is also needed. So this, the reader being the community health manager, the community health manager will be making arrangements for these. Now what is the condition of the patient, what is the patient going through, the patient's details, we have not uncovered anything so far, so let's get into that. Let's go back to the beginning of the case note. You are a community health nurse at Old Town taking care of elderly patients. So this is the writer's role. Okay. You are also a community health nurse. Assume today's date as 6 Jan 2024. So you will be using this date to start off the letter. Then now we are going to get into the patient's details. Patient name Mrs. Mary Smith. Okay, age 94 years. We already saw that. Our role is I am a community health nurse taking care of elderly patients, and of course the age of the patient is 94 years. The patient's address is given, which we generally don't need it in the letter. Then moving on to the social background, Retired retail manager, a 94-year-old patient, retired retail manager, when the patient is being moved to another community, is that detail necessary? It is not relevant, so I would say it as irrelevant. Lives with children, daughter part-time worker, son works from home. So this, now the patient, when the patient is being handed over to another care team, it is mentioned in the writing task, we have to include all the necessary background details. So of course we have to tell to the team who is going to take over the care of the patient that who all would be available at home with the patient. Is the patient going to be all alone? So to convey that idea clearly, of course we can include these details, that is these three aspects are necessary, which are relevant. Then we have details like finds difficult to use toilet and bedroom upstairs. Do we need that? Will make arrangements in new home with all facilities. Okay, will make arrangements. Then the last point given here is whole family moving to Bagnall's town, availability of bathroom and bedroom downstairs. So now what do we understand? One of the reasons that the patient is being moved to this new community is to actually sort out this problem of unavailability of bathroom or toilet and bedroom downstairs in their current residence. So like when the patient is being moved to a new community, of course we are making the reason for relocation clear to them. Maybe we don't know this is the sole reason, but this, of course, they have mentioned it clearly that whole family moving to Bagnall's town. This was the community where we saw the reader's address matched to. So this is the place where the patient is being about to be moved to. So we have, or we can tell the reader that now the patient is being moved to that new community into a home where all these facilities, bedroom and toilet facilities downstairs, will be available. So I wouldn't say that you have to make sentences out of all these 3 points, but these 3 aspects can be considered and you can summarize and make it as one idea or one sentence in the letter. So that aspect is necessary or relevant. Now we have looked through the background, social background. They have asked in the writing task, they have asked to outline the necessary background details. So from the necessary background details, which were the 2 aspects that we identified, that whom does this patient live with? Son and daughter, and one is part-time worker and the other one works from home. That those details are relevant. Then we have talked about the infrastructure infrastructure availability in the house, because in the recommendations we also read the need for an occupational therapist. So the infrastructure limitations in the current residence and the infrastructure which would be available in the new residence can be, or should be rather, mentioned in the letter. So we have considered that aspect as well. Now let's move on to medical history. Now you can see medical history and medications. Now what does the medications indicate? These are the routine or ongoing medications of the patient. So ongoing medications will have to be continued. So in such a case, those health conditions for which the patient is on these medications should definitely be included in the letter. Considering it in that way, we see warfarin here, warfarin 0.5 mg, regular blood test, dose varies, which means that this 0.5 mg is not a fixed dosage. Based on the regular blood test, the doses are varied, or the dosage is varied. Now this warfarin, definitely it will be for this atrial flutter, so this is relevant. Then again we see paracetamol for rheumatoid arthritis, which means that this is also relevant. So atrial flutter and warfarin relevant, rheumatoid arthritis and paracetamol again relevant. Then 2003 accident at home, hematoma, left leg bumped the chair. 2003, when are we writing the letter? We are writing the letter in 2024. So this is irrelevant. Then June 5th, again 2003, hematoma burst, admitted to hospital for surgery, wound repair. And again, sometimes students might feel that, oh, a surgery has happened, so let's inform that. No, but again, look at the date. This happened in 2003. And now we are writing this letter years later, 2024, and there is no further complication or anything regarding that, any traces of that. in the current. So we don't have to mention that at all. So this is irrelevant. June 10th discharge from hospital, irrelevant. Then UTI treated with amoxicillin, again 2005 UTI treated with amoxicillin. This also I wouldn't say it as relevant because that also happened many years ago. But since the patient had two occurrences or 2 episodes of this condition in 2 consecutive years, maybe the patient might have such a possibility. Maybe if you think it in that way as a semi-relevant detail, if you want you can include it, but I wouldn't say it as relevant. You need not consider that as well. So I hope medical history and medications part it's clear. Now we shall move on to the current situation. GP's appointment. 5th Jan 2024, which means yesterday. Today's date was given as 6th Jan. So on 5th Jan, what is mentioned here? Decreased weight 69 to 54, which means that is a significant weight loss. And the patient has reported weakness. So these 2 details are relevant. Then patient progressive to end of life care. Progressive to end of life care. This is a very important information. This is something which has been confirmed during GP consultation. Patient has been identified as she is progressing to end of life care. That is, the weight is reducing considerably and the patient reports weakness, and the patient's age, what did we note? 94 years old. And so the patient has been identified through this GP consultation as progressing to end of life care, and the patient do not want hospitalization. So despite this condition, the patient is not interested in moving to a hospital, but the patient has been identified as progressing towards end of life care. So this is the current significant aspect, end of life care. Now what has happened? So of course this is relevant, no doubt about that. Then 6th Jan 2024, what are the findings? That is today. This is today. Decreased weight, weakness again. Then daughter reports deteriorating health and increased frailty. Okay, that is to be considered. Then personal hygiene, can do showering, bathing, nail care, needs some assistance. For personal hygiene, needs some assistance. Okay, we have to convey that to the reader, of course. Then maintaining continence, requires assistance for toilet needs. Again, this should be conveyed to the new team. Can eat food independently. Of course, this also should be. We have to tell the current situation of the patient. Cannot cook, you don't have to say that, but yeah, the patient is able to, despite this weakness and requirement of assistance for personal hygiene and toiletry needs, the patient can eat independently. That also you can convey. Then mobility and transport, difficulty in transfer, difficulty in mobility, getting in and out of bed accomplished by repeated action. This aspect is also necessary. Walks with assistance of walking aids. So all these details are the most recent updates of the patient, or which you have identified today. So all of which should be communicated to the reader or to the new caretaker. Now, when I say all of these details, it does not mean that you have to make a sentence out of each of these points, but the summary of all these ideas should reach out to the reader. That is how it has to be constructed. When you develop sentences, the summary or the gist of all these aspects should be there. It does not mean if there are 6 or 7 to 8 bullet points under 6th January, 8 different sentences should be there in the letter. No. But the idea from all these 8 points should be reflected in the letter. Okay. Now, the next part, the recommendations we have already seen initially. Post move to the new home. From the social background, we understood that the patient is now moving to this town, Bagnall's town, and we are writing to the community health team in that Bagnall's town. So post moving to the new home in Bagnall's town, what are the requirements? Dietitian for daily dietary requirements. Now we understand that we are able to connect. The patient's weight is decreasing constantly and the patient has weakness and frailty. So for that, dietary requirements. Then occupational therapist for making arrangements in setting hospital bed at home. That also the patient stated that the patient does not want hospitalization and she experiences difficulty in shifting, moving, going to the toilet. All of this she experiences mobility. So an occupational therapist service is also needed. I hope by now the situation is clear. Now, at the end of 5 minutes of reading, you'll get an idea on all of these. After the 5 minutes of reading, don't immediately start to write your letter. You have to plan the letter and then start writing. Writing as in transforming the note forms into sentences. Now, as part of planning, what are the things that you have to do? Of course, we did the data selection. Data selection has been done with. Then you have to think of the organization. How we have to make the paragraphs. So what do you think? What do you think is the best organization or paragraphing for this situation? Now, before thinking of the organization, I would say that you have to decide on the purpose of the letter. What would be the purpose of this letter? Purpose of the letter is the introduction of the letter, which gives an overview of the letter to the reader. So it should not be too lengthy, but it should capture the main aspects of the letter. It should convey the main aspects or the main idea why this letter is being written to the reader. Now, what are the aspects that we generally include in the purpose paragraph? Of course, we mention the name of the patient. Then we mention the reason for writing or the requirement. Then we mention the current problem, right? Of course, the name of the patient, Smith, Mrs. Smith, it is easily, it can be, you can pick it out from the case note. And the reason for writing, why are we writing this letter actually? This was one area that actually confused a lot of students and put them in trouble. They had this concern that we were not able to pick out a specific medical diagnosis. So we spent a lot of time thinking that and what all details are to be included. So in situations where you don't have a medical diagnosis, what is to be done? You'll be clear with the requirement. Why are we writing this letter? At least that you have to get a clarity on. So why are we writing this letter? The reason why we are writing this letter is the patient is being now transferred to another community, and the patient's requirement is what here what did we identify? The patient requires end of life care. So this is the requirement. Now this is the reason for writing the letter. The patient who requires end of life care, the patient who has been identified as requiring end of life care from my care is now being transferred or shifted to another community. So the patient has to get the same care from that new community. That is the reason. Even though you don't identify a medical condition as such, it will be clear to the reader when you say, why are you writing this letter with these two aspects? So you have to understand here that the type of the letter here is a transfer letter. It might be difficult for some of the students to agree on this. No, the patient is not being shifted from a hospital to another place or another facility. So how can this be a transfer letter? Now, this would be not actually shifting the patient, but it is handing over the care of the patient. So it's transfer of care. This is transfer of care. This is one main aspect that you have to identify after reading the writing task. Just imagine this patient in one community, now moving to another community. Now the patient is not hospitalized or the patient is not admitted in a hospital. The patient comes to us for a regular visit. I am the person who is regularly taking care of the patient. Now from my care, the patient is moving out, shifting to another person's care. So it is actually handover of care. So this is a transfer of care type of letter. Now that is the reason for writing, and the requirement is end of life care. Now even if you cannot identify the current problem, that is okay, fine. It's just enough that you make it in the purpose paragraph clear to the reader who the patient is and what is the requirement of the patient. I hope that is clear. This was one area that confused the students. So in situations where you find it difficult to pick out a specific medical diagnosis, at least make sure that you are able to convey to the reader what is the requirement from the reader. At least if you do that, then half of the job is done. Now, yes, this is the purpose. Now, based on this purpose, how can you think of the organization? How we can paragraph? So, the purpose in the introduction, I would say that I'm writing to request the transfer of care for Mrs. Smith, who requires end-of-life care. You can also mention about the relocation. She will be relocated to your community shortly. So the reader gets an idea, okay, a patient who requires end-of-life care is coming to our community and we need to provide end-of-life care to the patient. Now that is the main idea. There is no main medical condition mentioned in the purpose paragraph. From that purpose paragraph, now you're going to expand the letter. So what do you think, which idea if we put it in the first body paragraph immediately after the purpose paragraph would be better? Do we need to talk about the current today's findings, or is it okay if we can start with the background details? I would say that in situations where you don't have to actually provide management for a specific medical condition, you can always start off with the background details of the patient. Because in the writing task also they have mentioned, briefly outlined the background, medical history and required care. They are not talking about highlighting the current condition of the patient. So I would say that I would definitely give an upper hand on organizing the letter by starting off with the background, then the medical history, then stating the current situation, and then you can wind up the letter with the recommendation. That's how I would suggest. Now we can go through a sample which has been crafted in that way. Here you can see. This is the purpose. I'm writing to request the transfer of care for Mrs. Mary Smith. You've mentioned the name, a 94-year-old woman who will be relocating to Bagnallstown with her family shortly. She requires end-of-life care. You made it straight and clear to the reader. That is, a patient is now coming to your town, is going to be relocated to your town, and what she requires is end-of-life care. Then you have started off with giving the or narrating the story of the patient starting from the background, because there's no urgency. You have to give the complete picture of the patient to the reader. So you start off with the background. Mrs. Smith lives with her daughter a part-time worker and son who works from home. The family is moving to Bagnallstown, considering Mrs. Smith's difficulty in accessing the upstairs toilet and bedroom in their current residence. So you're justifying, or you're making it clear, actually clearing that ambiguity as to why are they relocating. So it is because of this infrastructural limitations in their current residence, they are now shifting to Bagnallstown. That much details you give it in the social background paragraph. Then to the medical history, Mrs. Smith has a history of atrial flutter. We have selected that, and she's on warfarin with the dosage managed through routine blood test. Then she has also rheumatoid arthritis, that is also mentioned, paracetamol. Then we are coming to the current details. Now current details, as I said, you have to present the summary of it. There are a lot of details given there. Let's see how this can be done. Mrs. Smith is exhibiting declining health as evidenced by significant weight loss from 69 kg to 54 kg and extreme fatigue. Now, why are we including the 69 kg to 54 kg? We have a referral required to the dietitian, right? So this weight related aspect has to be mentioned. Declining health and this weight reduction. Then she requires support with toileting and partial assistance with personal hygiene. What are the kind of support that the patient needs? Then she also has limited mobility, needs support when getting in and out of the bed, and uses walking aids, because we have a request for the service of the occupational therapist as well. So this is also necessary. Then despite her frailty, she's able to eat independently. That also you can mention. Then notably, she has expressed the preference to avoid hospitalization. That is like the new community healthcare team, they does not know about this, that the patient is not willing for hospitalization. But the patient has already actually reported to us that the patient is not interested in hospitalization. So that part also we are conveying it to the reader, giving the complete picture of your patient to the reader. Okay. Then finally, winding it up with the recommendation paragraph, you are kindly requested to take over the care of Mrs. Smith upon her arrival in Bagnallstown. It would be beneficial if you could arrange for a dietitian to support her nutritional needs and an occupational therapist to assist in setting up a hospital bed at home. Okay, so recommendation, I don't think it's much confusing because 2 points are very clearly, specifically listed out there. You have to just take them, paraphrase it and put it into the recommendation paragraph. Purpose was a bit of confusing to the students because they had this thought that we don't have a specific condition to identify, so how to construct the purpose paragraph. But I think by now it's clear to you how to sort it out. Then another concern or another question was like regarding this organization. Would it be okay? I would say that both the organization would be fine. Starting off with this paragraph is also fine. But personally, if you would ask me, I would always go for this organization, starting off with the background in situations like this, when you are transferring the care without any specific medical requirement as such. Okay, and then like this end of life care, like some students have this concern, like can we paraphrase it as hospice care or palliative care? But here that also I would say that now here no terminal illness or such terminal conditions are not mentioned in the case note. So far as such conditions are not mentioned, let's not go for such paraphrasing. This might be just, this end of life care will be just related to this age, 94-year-old patient just with declining health. So it's better not to go for hospice care or palliative care. Let's keep it simple as end of life care itself. Okay. I hope the discussion was fruitful to you, and this is actually a different kind of case note which does not focus on a specific medical condition, and it's a transfer of care. So this actually was a bit of challenging to the students, but I hope this discussion sorted out those confusions. We'll be back with more such videos. Stay tuned. Thank you.
Medcity International Academy. Trusted hands forever.